TSRM, our Taiwan Association of Reproductive Medicine. We have many of our former presidents, current presidents, and our directors and our secretary generals who are really concerned of the fertility rate in Taiwan. And let me introduce Director Huang. Director Huang is in charge of the reproductive health in Taiwan and all the regulations also. But in Taiwan, there's a big thing which will happen within 1 year, that we will revise our Reproductive Health Act, which hasn't changed for past 20 years, for such a long time. So we need to do some change within this 1 year. Also, we will expand the subsidies for egg freezing, maybe soon, maybe next year, maybe this year. This year, okay, great. Maybe this year. So we have so much to learn from Israel. So hope we all have a very fruitful meeting today. Thank you.
Thank you, Legislator Chen. I would like to also welcome Dr. Xingyi He, the supervisor of Taiwan Society for Reproductive Medicine, and he's also the deputy director of Hexin IVF Center. So now I will hand over the moderator to Anita Yang for our main session. Anita, the floor is yours.
Okay. Thank you, Elsa. Hello, everyone. My name is Anita, and I will be the moderator today. And this session is divided into 3 topics. And if you'd like to ask a question, please raise your hand. And now let's begin with the first topic, Israel's IVF subsidy system, including eligibility and criteria. Does anyone has a question? Please raise your hand.
So maybe I will have Professor Geva to give us, yes.
Legislator Chen.
Okay. I think now we are facing a problem that our central government do not correspond with local government very well. So there are 11 local governments who already started to offer subsidies for egg freezing, and for very different criteria. Some give subsidy for social egg freezing, and some for medical issue, but mainly cancer, breast cancer or leukemia. So I like to ask how Israel led central government and local government to work well for these subsidies, because currently in Taiwan, all the patients, they have to fill out many forms for different government subsidies, and that's pretty troublesome for them.
Okay, so let's start with fertility preservation. So by the law, fertility preservation in Israel for both male and female are covered by the national insurance for some very strict criteria. First of all, as you said, is in your country for cancer patients, again, both male and female, and for people who have genetic problems such as permutation of fragile eggs or Turner mosaicism or other genetic conditions that may cause early loss of ovarian reserve, they are eligible for covering by the national insurance. Endometriosis as well, just in some specific criteria, not in general. People before ovarian surgeries, transgender people before gonadectomy, and so on. They're eligible for fertility preservation. But age-related fertility loss, I don't like to call it social or non-medical reasons, because there are medical reasons as well, but it's not covered. from time to time, although the medical indications are quite clear, because the national insurance can't cover everything, so it wouldn't cover it up till now. Just each year, a little bit more is being covered. I don't think it's important for you that I will name the exact criteria such as AMH and AFC and so on, but there are very strict criteria. That's it.
Thank you. There are some conservative groups who are not so supportive for this strategy is because they think egg freezing might postpone women to have their childbearing golden time. So they don't think this subsidy can really boost the fertility rate. Yeah, but I think for human rights senses, then of course we will start from cancer patients, right? No matter men or women. Yes. Yeah. But also we want to expand more, like Israel, to include some diseases, even if not cancer.
Yeah.
Yeah, we will.
Maybe.
Yeah.
After the evaluation.
So we have two questions. Does egg freezing policy postpone women who have their childbearing period? And second is how is the percentage they really utilize their eggs in the future?
Well, we look at egg freezing as a medical treatment, medical fertility treatment. And that's why women younger than 30 years old can't freeze their eggs in Israel. Only from age 30 to 41, women can freeze eggs. And up till age 35, they can freeze 25 eggs, and over age 35 eggs, but it's not unlimited. Although it's out of pocket and in the it's not covered, but you can't do everything. And it's some policy between the women's autonomy to decide for herself, but on the other hand, it's a medical treatment. It's not so we accept the policy that before age 30 there is no big difference between the age 25 or 29. And there's no reason to save fertility, to preserve fertility. And from 30 on, the results of IVF treatment and the general fertility is declining slowly, and later on more fast. And then this is the reasons beyond this decision. So it's something between autonomy and medical treatment. Now, we don't think that women use it because social reasons. It's not social reasons. Almost all women who use this fertility preservation is because they didn't find their partner until that time, and they hope they will find it later on. Some of them freeze eggs. Some of them freeze fertilized eggs with a donor sperm, and that's it. Now women could freeze their own eggs only in Israel, only from 2011. So it's not many years. So we don't know how many women will use those eggs when they are older. All over the world, the percentage of using preserved frozen eggs is about 15%, not more than 20%. So this is another reason why not to freeze eggs before age 30, because the younger the women, the lower the percentage of using these eggs, and the time of preserving is longer when the women are younger, and it becomes more expensive and so on. So it's all about medical viewpoint. And by the way, I was the president of the Israel Fertility Association some years ago. So I'm also an IVF doctor. So, and I came following a career as IVF doctor to the Ministry of Health. So I hope it's clear.
I noticed that in Israel, you also have the choice to freeze the ovarian tissue.
It will be covered also, the same covering, and the decision whether to freeze egg pieces or embryos or eggs are according to the doctor and to the patient, and to the disease, of course, and to the time that you have, and so on.
Thank you, Professor. Thank you, Professor. And sorry to interrupt briefly. We'd like to welcome Mr. Lin Yushen Lin. He is the section chief. Sorry. She's the section chief, Maternal and Child Health Division, Health Promotion Administration, and she's the Ministry of she's from Health Promotion Administration, and let's welcome her. And
hi everyone, I'm Yushen Li. I am the Division Director of the Maternal and Child Health from the Health Promotion Administration, Taiwan. Nice to meet you online.
Thank you. I think Dr. Liu has a question, please. Thank you.
Yeah, I think besides the consideration of autonomy, our country also focus on if the freezing of eggs and gametes can really increase the birth rate in our country. So considering the low utility rate in the past, or someone might postpone their age of birth, do you see the real benefit in this aspect? Maybe in the long term, we still have a good increase in our birth rate due to the subsidy of egg freezing.
I think egg freezing today is a very useful and efficient way of fertility preservation.
Yeah.
In Israel, it's not because of a general problem for the country, because, as you know, Israel is a pronatalist, has a pronatalist worldview, and we don't have a problem of the population that may decrease. This is not the issue. In Israel, it's medical treatment for the women. Your viewpoint might be different because of other problems, such as in France, Macron decided to subsidize egg freezing because the population of France is decreasing. Yeah. Maybe you have the same problem. So our viewpoint is different because our problems are different.
Yeah. But did
now,
you
just regarding of efficiency and efficacy, egg freezing in our hands and has excellent results, almost as using fresh eggs. Almost, maybe a little bit lower, but almost as high as using fresh eggs.
Thank you.
Just make sure to open the microphone, whomever would like to keep on and engage in this discussion.
Dr. Chu Jun Huang, please.
Yes. Thanks very much for Professor Geva give us such a precious time. And I have one small question. Currently, our government provide cover around 30% to, I guess, 50% of the IVF payment of our patients. And we try to persuade our government to increase the coverage. And we see that in Israel, it's really amazing that you provide fully cover of the IVF payment. And when we try to persuade, we face a question from our official that they are concerned that the clinics might increase the price, and therefore the patient may still pay more. And actually, they are afraid that they cannot decrease the payment from the patients. They will just they just pay more to the clinics. So I'm kind of curious that does the Israel government provide full coverage in the beginning, or the ratio just keep increasing from partial to fully coverage? And how do we persuade our government to increase the coverage of the IVF payment? Thank you.
Again, I think that you may help the government to increase the population. This is your interest. And our viewpoint is different because we are looking at all of this, at fertility treatments as a personal treatment, as a personal problem, as a medical problem. We decide that infertility is a disease. And if you look at infertility as a disease, then you should help people to be healthy, namely to have children. So maybe our viewpoint and the way we can help the government to decide to cover more is different than your viewpoint. Do I understand? Or am I right that this is the main different viewpoints?
Yes, thank you. I think that's the difference in the viewpoints when our government face the infertility disease. Thank you.
Maybe there are two different things. One is to reckon that infertility is a disease that may cause a lot of suffering and so on, and that's why it should be covered. And secondly, the viewpoint of the government about the population that decline and so on. Yes.
Okay. Thank you, Professor Geva. Dr. Liu, please go ahead with your question. A microphone.
I can't hear you.
Or microphone?
Yes,
Dr.
I have the idea that the Israel government think the fertility is kind of basic human rights. So I think you have a legislation to enforce the full coverage of the infertility treatment as a part of the one kind of disease. So it's to help people to be fertile, not to increase population in the beginning. But I also noticed there's a role of the insurance company to also try to help the patient in addition to the subsidy. How does the government do they force the insurance company, or do they have some incentives for the insurance company to support the fertility treatment by the insurance policy?
Professor Geva, if I may, because I think that all the distinguished guests here did not participate in an introductory call that Elsa and myself have had with Dr. Shalmon, where he actually represented the entire HMO structure of the Israeli healthcare system. So maybe you can give a little bit of an overview regarding how the HMOs are working, how is the Healthcare Act in Israel is actually controlling or maybe supporting the HMOs, so they will have a better or a wider context regarding the entire process.
You want to give this overview?
I think that
it's
you are
not just regarding fertility, I think.
Yeah, I think that is okay. So
this is another main difference.
Yes,
we have what we call national insurance. All people in Israel are covered by a national insurance. All the citizens and everybody. So you don't have to pay a lot to be covered by this national insurance. And the rates fixed and known to everybody, and the hospitals or doctors in the public hospitals and public units, and even private ones, can't take more than the rate that is fixed by the law, by the government. So there's no risk, as maybe here, because if I understand that the insurance is private, and the insurance in the health insurance in Israel is national, and the rates are fixed. So we are not facing this problem. Every year there is some increase to what we call health basket, and by the law they may add some other indications for funding. For example, the fertility preservation for patients with endometriosis was just added to the basket health this year. Every year we are trying to add more and more, and so on. Beside that, public health insurance, national health insurance, there are some what we call, they are private, but they are not, because the same organization are taking care of them. And again, the rates are not as much as you can. The rates are fixed, and the Ministry of Health are looking at them, and so on. So again, the systems are very different.
Yes, I would maybe add on top of what Professor Geva just mentioned, that from the healthcare point of view in Israel, the structure would be that in Israel, there are four main players, I would call it this way. It's called an HMO, healthcare medical operator. All the citizens and actually the residents of Israel that are entitled to get health insurance are either they're paying that like on a monthly basis. They are covered by the healthcare basket or healthcare portfolio, as we would like to call it, which is a portfolio containing a lot of medical services and including drugs and medications that are sponsored and covered by the government into different ratios. So fertility treatments are also part of the portfolio, and all the healthcare medical operators, as a citizen or resident in Israel, you have to be linked into at least one. So once you are linked to an HMO, you are able or eligible to get any treatment from the healthcare medical operator, and some of the rates, as Professor Geva mentioned, are controlled by the healthcare law or by the government. So I hope that gives you a wider context about how the Israeli Healthcare Act and services are working. And if you have any more questions, I'm here to help.
Okay, thank you.
There's a question from Dr. Chai. She would like to ask whether Israel cover the same-sex couple and single woman or man, and do you cover surrogates? The birth rate is quite high in your country. Why do people have the strong motivation to give birth?
Start from the end. The generosity in funding stems from a pronatalist overview, as I said, mainly maybe following the Holocaust, but also other religious and broader reasons. So this is it. I must say that I myself, I have 4 children because I wanted to have a large family, and it's not, many people have large families, not just religious ones. So this is the beginning, maybe. Now, regarding the question about same-sex and so on, maybe I say people in Israel are eligible to fertility treatment. Women in Israel are eligible for fertility treatment till their 45th birthday, until they have 2 children from the same family, for the same family, and family is either married couple or a same-sex man or same-sex women or single woman or single man. All of them are eligible equally. And now regarding third-party fertility treatment, this is not covered. I mean, the IVF treatment is covered, but the payment to egg donor or to sperm donor or to surrogate mother is out of pocket.
Thank you, Professor Geva. And sorry to interrupt briefly. We'd like to welcome Dr. Meizhou Chen. She is the Executive Director of Taiwan Society for Reproductive Medicine and the Professor of the Department of Obstetrics and Gynecology, National Taiwan University College of Medicine. Let's welcome Dr. Chen, and thank you for joining us.
Thank you. I'm very sorry that I have been late to the meeting. And it's my great pleasure, and I am honored to have this chance to learn from the Israel experience. Yes, I'm sorry for being late. Yeah.
Thank you, Dr. Chen. Okay, and let's move on to our second topic. Our second topic is the public communication on issues, for example, egg and sperm donation. Does anyone have a question? Please raise your hand.
I think Dr. Ho can also speak for himself because he has joined many meetings organized by some NGO who really care about the best interest of the future child. Because we will soon considering to legalize single woman or lesbian couples to use donor sperm to have children. So the first question is, in Israel, do you oversee a single woman's social economic status, I don't know, family support or the salary range, and to evaluate if she can take care of a child alone? Do you do this survey? And the second question is, how detailed would you let the recipient to know the medical record, or how detailed do you let them know the donor egg or the donor sperm? Yeah, because I think the medical doctors and the NGOs hold different opinions. So when we oversee the Human Reproduction Act, when we go through it, it will be an issue soon. Thank you.
So to our first question, we're not looking at social abilities or psychological abilities of people who using fertility treatment. And it has never been shown that same-sex couples or single women are less good mothers or less good parents than others, and so on. So this is not a criteria for eliminating people from being able to have fertility treatment. It's not a criteria at all. Now, you're right. Most of the people who are using sperm donation are single or same-sex, single women or same-sex female couples. They are eligible for treatment. Most of them use insemination. Most of them don't need IVF. They can be pregnant by insemination. Again, the cost of the sperm itself is not covered, but it's not very high. We have Israeli sperm banks that is regulated, and many people bring sperm from abroad, import sperm from abroad, In Israel, it's only anonymous. We don't have a non-anonymous sperm donation or egg donation. It's only anonymous. You can see photos of the donor. You know, his height, habits, his profession, his a little bit more, but that's it. Other question regarding maybe egg donor. Egg donor, we have a specific law for egg donation and for surrogacy. Women can donate eggs, namely have egg retrieval not more than 3 times in their lives, and it should be at least 3 months apart from each procedure, from a procedure to the other one. And each donation can be divided to no more than 3 women, so altogether it's no more than 8 families from one ovum donor. Again, the IVF treatment and so on is being covered by the insurance, by the national insurance, and they pay some extra to the egg donor. It's not a lot of money relatively. There is also a law for surrogacy. There is a committee in the health ministry, in the Ministry of Health, that should approve each agreement between the intended parent and the surrogate mother. All of them should have a psychological evaluation, and they should be seen by a psychologist and a social worker, and the committee, the members of the committee are doctors and lawyers and so on and so on. And the surrogate mother, again, the cost of this agreement is much higher than sperm donor, egg donor. Men, same-sex men or single men can also are also eligible to be helped by surrogacy in Israel.
Thank you, Professor Geva. Dr. Mei-Jo Chen, please.
May I ask a question? Yes. My question is, I'm curious about that. Is Israel, do you have any restriction for the amount of the money for compensation from a infertile couple to the egg donors or sperm donor? I mean, do you say the limit, the restricted amount of money, or it depends on the demand and the market? I mean, did you set any, like Taiwan, we have some regulation, like the egg donors only can get the minimal, not the minimal, a fixed amount of money for compensation. But is there any?
The same in Israel.
Same, okay.
Regarding egg donation, it's a fixed price. Some of it is covered by the Ministry of Health. This is an exception for from the national insurance because it is covered by the Ministry of Health, about a half, and the other half by the recipients. And it's fixed price, the egg donor, the donor eggs.
And
now regarding
thank you.
Regarding the sperm donor, there is no fixed price or any legislation about it. And regarding surrogacy, the committee should accept the agreements between the surrogate and the surrogate mother and the parents to be, and they wouldn't approve an agreement that is not for the best of both sides, of course. So it's not regulated by the law, but it's about fixed price in most cases.
And thank you. And my another question is, Israel allowed the egg bank or the sperm bank? I mean, because some people may say it's hard to find the egg once there are some demand, so they have set up some egg bank just to allow the patient who just want to have the donor egg, then they pay for the organization or the IVF center to get the egg bank, to get the donor egg from the egg bank. Is there any regulation for this?
There's no regulation about egg banks. We don't have egg banks because most donated eggs are being used quickly, so we can't have bank eggs.
Okay.
It's not against the law, and we're now thinking about how we can help Israel to have banks of eggs. I'm for this idea. We are talking and thinking about it. Now we do have sperm banks, which is easier to be arranged. We have in Israel, for example, 17 regulated sperm banks. The sperm banks, of course, are regulated. The sperm donors should make genetic and serological tests and so on. And we know about each one can donate in only one bank. So this is the way we can regulate it. No sperm donor will have too many children. So again, the sperm banks are a little bit more regulated than the oocytes, the egg.
Okay, so there's a question regarding the sperm bank from Dr. Chai. She would like to know who runs the sperm bank, by the government or by private clinics?
It's a very good question because there is difference in Israel. We do have primary law by the parliament that regulates egg donation and regulates surrogacy. We don't have yet a law for sperm bank. We are working on it. It is regulated, but what we call secondary regulation, not by the government, not by the president, not by the parliament, by the Ministry of Health. And we are working. Of course, I don't know if they can promise anything, but there is some difference between it's not ideological difference. It just happened that these two laws came to the act and the other one didn't do it yet.
Okay, so there's another question from Dr. Chen Mingzhe. Does Israel government subsidize PGT?
Yes.
And how the government decide resource allocation at different parts of fertility treatment?
So again, to be eligible to do PGT, you have to have an approval from the Ministry of Health. In Israel, there are many excellent genetic institutes, and so in many IVF units, PGT is also offered. And the national insurance is covering the severe diseases such as Tay-Sachs, Fragile X, cystic fibrosis, thalassemia, and so on. Not everything is being covered, but the severe diseases are covered.
And thank you, Professor Geva. Dr. Liu, please go ahead with your question.
Yes, it seems that in Israel, one egg donor can donate to 8 couples to achieve pregnancy. But in Taiwan, we have only one donor can only have one family. And when we did the law, there's no scientific base to do that. But how about in Israel? How did you decide on 1 to 8 instead of 1 to 10 or 15? Do you have some way to calculate the number limited for the recipients?
regarding egg donation, it's 9 actually, 3 times 3 families.
Yeah.
In the end, people who know that they are from egg donation, they can choose. They can make sure that they're not going to marry their half brother or sister, because there is again anonymous and secret registry that all of these donations and recipients and the children that are being born from this, they are in this registry. Everything is written. So in the end, the harm of married your sister, brother, so on, is very low. On the other hand, it has been, you always go between not to produce too many children, but on the other hand, if you have just one from one, you don't have enough egg donors.
Yeah.
So the decision is to try to go in between and to fulfill the needs for everyone. Of course, we cannot. All the fertility doctors here understand that you can never fulfill them all. So we go in between. We try to do our best.
And also a follow-up question of Dr. Chen Minze. So how about PGDA for only selecting the embryo to be prioritized, a priority to transfer, not for disease? Do you pay for that kind of PGDA, just for the selection of embryos to be transferred?
PGDA, first of all, PGDA has never been shown to help people to increase the pregnancy or the life. Particularly, it wouldn't increase the live birth rate.
Yeah.
So it's not a fertility treatment. So it's not covered.
Okay. So only for PGD, not for PGTA for general use. Yeah.
From time to time, it's PGT-SR for translocations and so on. But for disease, it's not for.
Yes. Thank you.
Thank you. And now let's move on to the third topic. Our third topic is keys to the success of policy implementation. Does anyone has a question? Please raise your hand. Dr. Mei Zhou Chen, please.
Yes. I'm sorry for being late earlier, so I might miss some very important information, but I do really want to know that since we learned from Israel that Israel subsidized not only IVF, but also social elective oocyte freezing. So I'm wondering that have you do any survey that what kind of the policy, I mean, subsidized for the IVF treatment and comparing to IVF, not comparison, just among all these policies, including subsidized for IVF and subsidized for egg freezing, which kinds of the policy the Israel government implemented are approved to be able to significantly improve the fertility rate? What kind of policy works the best, most helpful from your experience? Yes. Thank you.
Indeed, we talked about it in the beginning. So let me write something in the chat. We talked about it in the beginning. Do you want to repeat the issues?
Sorry, I want to know what kind of policy that Israel government had implemented achieve the most helpful outcome in improving the fertility rate.
I'll read it quickly. Israel does not have a problem with fertility rates in the general population. We look at it as medical treatment to treat infertility. We're not looking at any problems of the nation, things like that.
So is that means from government Israel governmental perspective, you don't think subsidized IVF treatment or social egg freezing as a tool, also a method to improve, to solve the.
Again, I repeat, we don't look at fertility preservation, particularly talk about egg freezing as social treatment. Fertility preservation for aged women is a medical fertility treatment because they can freeze their egg if they have any disease that may harm the ovarian reserve, and we gave all the details, then it's a medical issue and it is covered. I hope that later on maybe a part of the age-related fertility loss will be also covered. We can't cover everything. So a part of it is covered, but we look at it as medical infertility treatment because it's not, I don't like the word social treatment. It's not a social treatment. It's age-related fertility loss, fertility treatment.
Okay, thank you. So what kind of what age, what age you define them as age-related fertility loss? 40-year-old or 35?
Between 30 and 41.
13 to 41. Okay, thank you.
Thank you.
Again, sorry. Yeah.
Legislator Jinghui Chen, please. Microphone, please. Okay.
Sorry. I think it's pretty clear that you are not doing this human reproductive technology to boost the fertility rate. Now we realize that, but in Taiwan, we are facing a crisis because we are the lowest fertility rate in the world. So human reproduction technology becomes one of our solutions. So I think I'm wondering if we broaden the candidate, like we legalize single woman or same-sex couple, lesbian couples to use this technology might be really helpful for our fertility rates or not, according to your experience, because it's a huge step for an Asian country.
Yeah. So same-sex couples from time to time don't have fertility problems because they may use sperm donors or egg donors. And the same-sex men also use surrogacy. I don't think that the numbers are that high that they will affect the national fertility rates. In Israel, I don't think this is the issue. So we simply treat everybody the same. We don't think that the rights of same-sex couples or a single woman or a single man is lower than a family, those who are officially married. So I don't know. I don't think Israel can help assuming whether if you add same-sex and so on, it will help to increase the population. I don't think I can give any advice.
Okay, so thank you, Dr. Geva. And there's a question from Dr. Chai. What is the percentage of fertility promotion budget among the total national budget in Israel?
Vin, do you want to hear?
Again, if you can repeat the question, sorry.
Okay, what is the percentage of fertility promotion budget among the total national budget in Israel?
So this information needs to be allocated from the Ministry of Finance reports. It is well detailed within the Ministry of Finance general report for the budget. We can look it up and provide it later on. No problem.
Thank you.
Does anyone has a question? Please raise your hand, and this will be the last question. Dr. Mei-Jo Chen. Chen Ming-zhe, sorry, Chen Ming-zhe.
Yeah, I will read it out. The Israel government do post hoc analysis from current policy and ever do any change of decision?
Yeah, the Ministry of Health conducting yearly presentation of aggregative results of all the units, so we know how many treatment cycles has been done, and the results, the live birth rates, the multiple pregnancy rates. For example, we decided some years ago that it's very important to decrease the rate of multiple pregnancies. So we used many methods to do it publicly and by the law. And now the rates decreased from, let's say, 11.7 in 2018, and the last year it was only 6.5%. So we are regulating a lot of the criteria and the results and so on. We have the aggregative results published every year.
Thank you, Professor Geva. And this is the end of discussion session. And I will hand it over to Elsa for the photo call and closing remarks. Elsa, please.
Okay, so does anyone have any questions for that, Professor Geva?
I think Dr. Liu has a last question.
Okay, please.
I think the society always doesn't have to persuade government to subsidize IVF because it's already in the legislation. But I'm wondering, up to now, what's the percentage of IVF baby among all the babies? Is it close to 10% or something like that?
Yeah, indeed it increases every year, and in the last year it was about 5% of the life born in Israel.
Thank you very much. Thank you.
Okay.
So, any further questions? Yeah, no? Okay. So, before we finish today's meeting, so let's take a group photo. So, please smile in front of your camera, and I will take a screenshot. So, hold on a second. Let's say, okay. So you can turn on your camera if you have. Okay. So let's say cheese. Cheese. One more time. One more time. Say cheese. Okay, let me screenshot of it. Okay. So thank you for all your participation today. So if you have any further questions, you are welcome to write me the email, or if you would like to have connect to Professor Geva, then we will consult with her to get these connections. So thank you for all to participate, and really thank Professor Geva to share all the experience and the policy and system in Israel. Thank you, and goodbye. Have a good day.
So lastly, we would like to welcome Professor Geva to visit Taiwan anytime.
Very much. Thank you.
Thank you. Thank you.
It was a very interesting meeting, I think, to us also because of the different viewpoints about fertility and infertility treatment, about the problem of the different population and so on. It was interesting for me as well. Thank you very much for this. Very interesting.
And Su Yang Health Minister of they would like to provide you a data that in Taiwan, babies from compensation is 6.7%. So if not from conversation, maybe more. So that's the data in Taiwan.
Thank you very much. Bye-bye.
Thank you very much. Bye-bye. Have a good day.
Thank you all. Have a good day. Thank you. Bye-bye.
Bye.
Bye-bye. Thank you.